in Dublin by consultant cardiologist Dr. Caroline Daly. Dr. Daly, thank you very much for joining us this evening. And obviously all areas of the health service have been affected, but in cardiology, your own speciality, how have you been affected by COVID-19?
So I suppose the first thing to say is that acute emergency care has been protected throughout. So patients presenting with a heart attack right through the most acute phases of the pandemic have been treated, and so patients presenting with a heart attack continue to come in the middle of the night and be treated. We did see a dip in the numbers in April, but from May onwards the numbers are comparable with those that we would experience at this time of the year usually. So, and that is good because there was a concern that patients weren't presenting with acute heart attack symptoms. But we do see that over the summer months that has risen back to almost normal levels. What we have a challenge with, however, is in dealing with chronic cardiac conditions and the waiting lists, like you pointed out, that have accrued during the times when things have been postponed. So, for example, patients who present with a heart attack, have the stent inserted in the middle of the night, they benefit and their survival is prolonged by cardiac rehabilitation services, which have been compromised during the COVID period. And they had just been beginning to start up really at the end of the summer, and they now look as though they're going to be put on hold and postponed for a long period again. Other services that have suffered are things like chronic heart failure, where redeployment of important specialist nurses and other staff members who contribute to the care of the patients, their redeployment means that sometimes patients don't have the access to specialist services that they need in a timely manner. And we've seen that with a 26% rate of redeployment of heart failure nurses, there has been an increase in hospitalizations with heart failure in certain centres as well. And then in addition to that, you mentioned that social distancing as a requirement and also the increased need for sanitation between cases means that we're operating at a substantially reduced capacity for all procedures, invasive and non-invasive. So where we had a waiting list before COVID ever appeared, we have now accrued an additional waiting list through the cancellation and postponement of some procedures. We're operating at less capacity than usual in our attempts to try and deal with that waiting list.
And we know that one of the key things that the government and the HSE are trying to do is to keep normal services going at the same time as dealing with COVID. Looking at those numbers for the increasing numbers of hospitalisations for COVID, are you going to be able to keep going with your normal services if things get really bad again?
Yes. So I think cardiology, acute cardiac services, life-threatening cardiac emergencies kept going right through the COVID emergency the last time, and they will continue to keep going because, you know, we can intervene and we can save lives for cardiac emergencies, and so they will need to, those services need to continue. What is more of a challenge are the patients who have conditions where the duration of time for where they need treatment is measured more in weeks and months rather than hours or minutes, and those cases are being postponed, and that will perhaps become a challenge, and we need more space and more people to be able to provide those services.
Okay, capacity and staff and the issues as always, but Dr. Caroline Daly of St.James Hospital, thank you indeed for joining us.